everyone. For our treatment project, we decided to focus on AAC device use for patients with aphasia, done by Ava Charleston, Leah Roberto, and Victoria Basone. Our client is named John Walter, and he is 62 years of age. His diagnosis is Broca's aphasia secondary to a left hemisphere ischemic stroke. John is a very outgoing individual who lives with his spouse and has 3 children. Prior to his stroke, as a hobby, John had a column in the local newspaper where he reviewed different restaurants. He is excited to improve his communication abilities and is ready to actively participate in therapy. As for his educational background, John received his bachelor's degree in business administration from Monmouth University and worked for 25 years as a financial manager. Approximately 9 months ago, John had a left middle cerebral artery ischemic stroke. Residual deficits include Broca's aphasia and mild right facial weakness. John also experiences hypertension. What is AAC? AAC stands for Augmentative and Alternative Communication and are tools that support or replace verbal speech. Low-tech AAC devices include picture boards or alphabet boards. Mid-tech AAC devices consist of single message devices, and high-tech AAC involves tablets or speech-generating devices. And overall, all these platforms are used to enhance communication and decrease frustration. Why use AAC in aphasia therapy? AAC use supports expression when speech is impaired, provides alternative methods to communicate an individual's wants and needs, reduces communication breakdowns, allows participation during recovery, and does not necessarily have to be viewed as a replacement for speech, but in some cases works alongside restorative therapy.
AAC devices can benefit people with a wide range of aphasia profiles. To start, they can help with individuals that present with expressive aphasia or non-fluent aphasia, so the Broca's or transcortical motor. These individuals struggle with verbal output, but their comprehension is intact, so AAC just supports expression when their speech is very effortful or limited. Next, they can help people with global aphasia. These individuals have severe impairment in both comprehension and expression, so AAC can just help benefit them from a highly visual system and help them communicate their basic needs, their choices, and any feelings that they want to get across. It can also help people with anomic aphasia, with those frequent word-finding difficulties, as AAC can serve as a backup when the lexical retrieval fails. And it can also help with individuals with aphasia that just have slow processing speech that can help reduce that communicative pressure. For the long-term goal, our client will independently use a personalized AAC system across daily communication situations to express needs, participate in conversation, and communicate effectively with 80% accuracy. The first short-term goal is that the client will use AAC to generate single words in structured tasks with minimal cues in 8 out of 10 trials. The second short-term goal is that the client will initiate communication using AAC during functional tasks with moderate cues in 50% of opportunities. The last short-term goal is that the client will navigate their device on all pages on the AAC device with 80% accuracy. There are a few steps to the process and protocol of assessing someone for an AAC device and then overall leading to the treatment. So the first step is your assessment of the client and their needs. The second is device customization. The third is teaching and practicing. The fourth is partner and family training. The fifth is progress monitoring. And lastly, long-term goal generalization.
Assessment and customizing the AAC. In the assessment phase, we look at the client's communication needs and their daily routines. We check vision, hearing, motor abilities, and gather information from both the client and their family. Once we understand their needs, we customize the AAC system. And this can include adding personal vocabulary, names of important people, routines, and commonly used phrases, for example, I need help. We adjust the layout, size of icons, and screen organization so it's easy for the client to use, and everything is tailored uniquely to fit the client's goals. Teaching and functional practice. So after the system is set up, we teach the client how to use it. This happens during natural functional tasks. For example, we might practice ordering food at a restaurant, asking for help during therapy, or talking about daily events. The goal is to build confidence and make AAC a natural part of communication, not something that's only used in therapy sessions. Partner training and progress monitoring. Partner training is a big part of AAC success. We teach families and caregivers how to wait for responses, how to model using the AAC device, and how to encourage the client to use it in their daily lives. We also track progress by looking at accuracy, independence, and how often the person initiates communication. All of this helps to make sure that the AAC device becomes useful and a long-term tool for the client.
Hi John, hi Sarah. Thank you for being here today. We're going to practice using John's communication device so he can express himself more easily. John, remember you could speak, gesture, or use the device, whatever works.
He's been practicing a lot at home with the device, but sometimes he gets stuck.
That's completely normal. We'll walk through everything together. John, I'm going to show you how we could find a drink on your device, just like we practiced. First, you're going to tap food, then drinks, and then you'll be able to select whatever you want.
Coffee.
Awesome job! John, what would you like to drink? Take your time. If needed, you could also use the device.
Juice.
Great job using the device to tell us that you want juice. Now let's try something a little bit harder. John, can you tell me something you enjoy doing at home?
It's okay. Try your help button.
I can't think of the word.
Well, I'm asking you a question about yourself. So you're telling me about you. And I'm asking about your favorite hobbies at home, which are your interests. So tell me, what do you like to do as a hobby?
Baker.
Baker.
Awesome job using your device and your speech. Sarah, at home you could definitely model for John using the device. For example, if John points to help, he may tap.
Turn on the air.
And you could say, turn on the air. Do you want me to turn on the air?
That makes sense. I could definitely try that at home for him.
Yeah, this could definitely help him learn without feeling pressured.
Great, thank you.
Okay, great. Let's end with a short conversation. John, can you tell Sarah who you would like to call today?
Daughter.
Daughter? You want to call our daughter? We can do that later this afternoon.
Beautiful communication. Thank you so much for watching this video on how AAC use helps individuals with aphasia effectively communicate.
Using AAC devices helps people like John communicate in their everyday lives.
Thank you for watching.